Imagine waking up every morning and putting on a heavy backpack. This backpack is filled with invisible weights, worries, fears, doubts. And each step you take, it feels heavier and heavier. Anxiety is like carrying around this backpack everywhere you go. It affects your thoughts, your actions, and your interactions with the world. It can make simple tasks feel overwhelming and big challenges seem impossible. Worrying about your job, your health, your relationships, your self-worth, it can be all-consuming. Even minor things like punctuality or cleanliness can put you over the edge. It's exhausting, right? However, this could be more than just stress. This could be Generalized Anxiety Disorder, or also known as GAD. But what if you could learn how to lighten your load, to unpack the backpack and understand these weights and what they are? In this video, we are going to unpack anxiety and talk about GAD and their impact on you. Is GAD common? We're going to talk about the specific diagnosis for Generalized Anxiety Disorder, the symptoms of GAD. How does GAD affect different age groups? What are the treatment options for GAD and their effectiveness? Stay tuned to find out if your worry is something more serious and learn the steps that you can take to reclaim your peace of mind. GAD involves excessive worrying about many aspects of life. This worrying often centers around striving for perfection, avoiding mistake, feeling responsible for everything, and trying to stay in control to prevent bad things from happening. GAD can be compared to an avalanche, where little worries about many different aspects of life begin to build and build. But as more and more snowflakes accumulate, the pressure gets heavier, and over time, these worries pile up one after the other until the pressure becomes too much to bear. And then, just like an avalanche, the anxiety crashes down, overwhelming everything in its path. It can feel uncontrollable, consuming, and impossible to escape. Sometimes we don't even recognize what we're worrying about or what GAD is. Here are a few key points to understand about what may be building in your own life or someone you love. To diagnose GAD, mental health professionals refer to criteria in the Diagnostic and Statistical Manual of Mental Health Disorders, also known as the DSM-5. Here are the key points. The key points of GAD are excessive worry, which is characterized by excessive and widespread worry about various aspects of life, such as relationships, health, work, finances. This worry often focuses on striving for perfection and avoiding mistakes. The next is duration. The worry must be persistent for at least 6 months, and it should not be directly caused by another significant event, such as a divorce or some type of trauma. Individuals with GAD often find it hard to control their worry, which can affect their ability to sleep and concentrate. So the next component is physical symptoms. At least 3 of the following physical symptoms must be present for at least 6 months. And these physical symptoms cannot be due to some sort of physical condition or health condition. And these physical symptoms include feelings of restlessness or feeling on edge, fatigue, difficulty concentrating, irritability, muscle tension, sleep disturbance. If you relate to the points above and believe you may be struggling with anxiety, please know that you are not alone. GAD is a common mental health issue, and it affects 4% of the general population annually. In the US, around 12 million people suffer from it. When combined with other anxiety disorders, this number rises to 10 to 12%, making anxiety disorders the most prevalent mental health issues in the country, more common than alcohol or drug abuse. So people from all walks of life, regardless of income, job, ethnicity, can experience GAD. It's less common among younger people, but becomes more prevalent with age. Over 7% of elderly suffer from GAD, and they often worry about health and safety compared to younger individuals who worry more about work, relationships, and sociality. Many symptoms of GAD resemble those felt by individuals who have endured significant life traumas. So for instance, someone who loses a loved one might experience excessive worry and physical symptoms similar to those with GAD. But with GAD, the worrying happens even when there's no specific bad event going on. And that's really the key difference. Another factor is also the duration of the worry and physical symptoms. If even a year after a traumatic event, you continue to excessively worry about various aspects of life and still feel physical tension, it might be GAD, possibly triggered by the trauma. But for a diagnosis, the worrying and the symptoms must be present for at least 6 months. Everyone worries from time to time, but GAD is characterized by excessive worry even without a real threat. Here are some questions to help you to determine if your worry is abnormal. Do you find that you worry about things that most people don't seem to worry about? Is your worry exaggerated, perhaps compared to what other people worry about, like being overly concerned about your children's safety or possible things that could happen? Do you find it hard to stop worrying and to relax when other people seem to have an easier time doing this? Do you worry about not being worried, or worry when everything is going well in your life, thinking that this is perhaps a problem? Do you worry without finding any solutions? And also, do you believe terrible events will happen if you stop worrying? So if you answered yes to the majority of these questions, you might be experiencing abnormal worry indicative of GAD. GAD can overlap with other anxiety and mood disorders. So if you also feel sad and hopeless in addition to the excessive worry, it might be worth consulting a mental health professional for the treatment of depression or perhaps some other mental health issue. If you are someone who worries a lot and you're ready to commit and put in the effort, then this course will be very beneficial for you. This anxiety course aims to help you to control your worry and anxiety through structured step-by-step videos that build on each other. You will learn skills to reduce physical tension, control excessive worry, and handle real-life problems effectively. Regular practice and dedication are crucial for success. Success largely depends on your commitment and practice. So think about this. You're probably already spending a lot of energy worrying and feeling anxious. By putting the same energy into learning how to overcome your anxiety, you'll see positive changes. So don't judge. Even if you have your doubts, try it out first. Try making these changes and see the results before deciding. So in this video, we covered the criteria for the diagnosis of GAD, the prevalence, the symptoms, the impact on different age groups. We also discussed distinguishing between normal and abnormal worry and details of the program designed to help manage GAD effectively. Now, remember, understanding and addressing GAD can significantly improve the quality of your life. If you want to learn more about how to transform your anxiety by rewiring your brain, stay tuned for my next video on specific anxiety symptoms and how to start charting. Thank you for watching, and don't forget to hit like and subscribe, and also hit the notification bell for more content on mental health and wellness. In the next video, we will discuss how to recognize your specific anxiety symptoms and how to start charting them. If you have any questions or experiences to share, leave a comment below. And to explore more about managing anxiety, check out this next video. Thank you for watching and have an awesome week.